So I've been using HawkGrips tools for the past 2 years. We started using them after receiving an in-service training from Frank Osborne. We put them into practice. Really, we learned on Wednesday. We started using them that afternoon. I would say HawkGrips have not only changed the way that I practice, but they've changed the entire practice of our department and our team. It's totally changed our perspective in terms of how we manage the soft tissue within our patients. And we started with a small set, just a trial, and that's now quickly grown into about 10 different sets spread out over 4 different facilities. So it's become an integral part of the practice, not just at my facility, but throughout the entire Johns Hopkins institution. So, we choose a systematic approach with the HawkGrips. HawkGrips has, a number of different tools that all have different contours and bevels that are unique to the type of application that we would do. I know that there are some multi-tools on the market. There's a couple things. First, we look at fit and finish. When you look at the beveled edges of the HawkGrip tool, they go through a very refined machining process. I'm putting super smooth surfaces against the patient's skin. So the risk of that roughness, any scraping or agitation to the surface of the skin that might be there, I think is greatly mitigated by the quality of the tool itself. The type of patients that I see a lot of medical executives, CEOs, physicians, family, professional athletes, as well as recreational athletes. And my philosophy is that I want to be the best for the best. So I'm not going to put something on a patient or use a tool or device that is not the very best quality that I can put forward. So, we take a sort of approach of both, we compress and then we decongest. So once we've gone through the mechanotransduction, using of the soft tissue tools to mobilize the tissue in a compressive nature, what we then do is use the physio-touch as a decongestion or decompression. So we're then taking and creating a method of mobilizing the fluid and the byproducts of the whether it be the exercise or the soft tissue mobilization tools, so that we can take and flush out the byproducts of that process and allow for optimized healing. So we've then adapted that into a method of myofascial release. So a lot of myofascial release is applying a compression or a tension. What we're doing is creating a negative tension or distraction. So we're mobilizing the tissue in all 3 planes of direction. And I think that it ultimately yields a better patient experience, a better outcome. And it's a nice complement to sort of the aggressive nature of the compressive. A lot of patients find the decompression a very relaxing, very comfortable treatment.